5 days ago, I had a vaginal hysterectomy, which was not laparoscopically assisted, with a Dr. Kung at the Kaiser Redwood City hospital. They discharged me the same day. I've found out that healing is not necessarily linear. I had a lot of energy on my third day post-op. I went for a really long walk. My friends came over and played Scrabble with me. I read a book. And then yesterday I spent 18 hours in bed, getting up every few hours to pee and eat. I woke up at like 3:30 and went to bed again at 9:30. I was just very exhausted, very tired. I have a little bit more energy today, but not a ton. I have a little list of things here so I don't forget. So sorry if I'm looking at my phone. I am 27 years old. I had no cysts, I had no fibroids. I've never been pregnant. So my uterus was pretty small and the procedure went very well. Like I said, they did the entire procedure through the vaginal incision. I don't have any external scars. The reason I got the hysterectomy was because I had severe dysmenorrhea, severe primary dysmenorrhea, and have had for 16 years. And we had tried everything else, and this was the last resort. I don't have any children. Like I said, I've never been pregnant. I'm like 50-50 about being a parent one day, but I have no need or desire for that child or children to be a part of my biological DNA, to have come from my body. I'm totally happy raising a child that isn't like genetically related to me. That's not a thing that I find important. So basically, out of everyone's hysterectomy experiences, mine is probably going to be the quickest healing time and the least painful out of anyone's. Like I said, I'm young, I'm fit, I'm healthy. I didn't have any cysts or fibroids. They removed my cervix and my uterus and one of my fallopian tubes. Apparently my other fallopian tube was stuck and they couldn't get it out. And then, like I said, my uterus was small, so it was a pretty easy and quick procedure. And they let me out of the hospital an hour after I woke up. One thing that I regret is not coughing during the first 2 or 3 days. Apparently, coughing is actually really important and can go a long way to prevent pneumonia. I wasn't coughing because I was really scared of hurting myself or injuring myself or rupturing a wound. So I was forcing myself not to cough. But then the downside of that is that the last 2 days I've been coughing a lot. Because it's like once the floodgates broke, then I just wanted to cough a ton. And so you can cough if you have a pillow near me. No, I don't. But they said if you need to cough or sneeze, grab a pillow and hold it to your surgery site firmly, and then cough or sneeze. But like, I never have the luxury of foresight, when I'm about to cough or sneeze, to get up and walk over and find a pillow and hold it to my abdomen like I'm just gonna cough or sneeze. So what you can do is take your arms and place them over the surgery site firmly. Don't push hard, but like firmly, and then cough. And so that's kind of meant to keep everything together, I guess. So yeah, coughing's actually really important after surgery. My throat has been incredibly scratchy the last 3 days. I have not slept more than 4 hours in a row since surgery, so 5 days now. And the primary reason actually has not been because of the pain from the surgery. It's because I've woken up and my throat has been really scratchy, really itchy, or I've been coughing, or because I've been sleeping on my back a lot because that feels the most comfortable right now. I felt like this weird kind of drip down my throat. I'm wondering if I'm getting a little bit sick. I got the surgery in the middle of winter, so it's very cold, and I have been going for walks because walking is important to prevent blood clots, but that means that I have been outside in the cold a bit, and my immune system is obviously a bit compromised because of the surgery and the anesthesia. So I'm worried that I've been a little bit sick. But I've been taking my temperature twice a day, and it hasn't gone over, I think the highest it was 98.9, which is like high-ish, but it's definitely not in fever range. So they said as long as I don't have a fever, I should be fine. Sleep and rest is really, really important. So yeah, that was kind of a thing that I didn't really do the first few days. Like, I was sitting a lot, but I wasn't really lying down. And then, like I said, I think I overexerted myself on the third day. I went for a walk, and it was like a walk that should have been fine, except I forgot that there was a small hill, like near the end of it, and I should have just stopped at the bottom and like turned around or called someone to pick me up. But I walked up the hill very slowly and very determinedly, and I was just exhausted once I got to the top. I just had to sit down. I was completely wiped. Don't do that. Flat walking's good, incline's not great. If you have stairs in your house, make sure that you have someone there to physically help you get up and down those stairs, at least for the first 3 days. I found stairs a big challenge, like very difficult. Something that I've enjoyed having is, because like I said, I've been waking up a lot, is my light switch is very high above my bed, and I can't reach it while lying down without sitting up a little bit and engaging my core. So I had these lights, which I love. These lights are from Nanolief, and they're on an app, so I can basically just turn them on when I want to from my phone, and then turn them off when I want to go to bed. And that's been really helpful because just like don't engage your abs. I don't need to sit up, so I don't have to. There's a lot of fear mongering online about women getting hysterectomies, and like how dangerous it is. I say women specifically because there's not a lot of fear mongering aimed against, like towards trans men. I'm gonna leave that cough in there just to show that you can cough after a hysterectomy, and it's not incredibly painful as long as, well, like I said, my procedure is probably the least painful, so I don't want to speak for everyone, but that didn't hurt me. And it's good, getting potential pneumonia out of my lungs. Yeah, there's a lot of fear-mongering online, specifically targeted towards women to make them scared about getting hysterectomies. And, you know, some people do have really terrible experiences, but the reason that I did want to share my experience is because I'm doing really well. I'm doing fine, you know. There's also a lot of misinformation. Like, I kept my ovaries, so I shouldn't have any hormonal fluctuations, any, like, surprise menopause. Again, I said targeted towards women because there's not really much fear-mongering targeted towards trans folk getting hysterectomies. The last thing I want to talk about is stool softeners. So take them. My doctor told me to take a stool softener every time I took an oxytocin, an oxy pill. Yeah, that's like the really strong painkiller. But then my mother-in-law suggested that I take them in the mornings because I was taking the like harder painkillers at night to sleep better. But she said that I might not want to take a stool softener just before I go to bed. So I decided to take them in the morning. I think I've taken 3 or 4 since surgery. So not the first day, but every other day. I didn't take one this morning, but I also haven't had oxy since yesterday either. It's definitely, I didn't take any stool softeners or laxatives after my top surgery, my double mastectomy, even though I was told to, because I wasn't having any trouble with bowel movements, but that's because you still have, like, can use your abdominal muscles. Like right now I can't squeeze. Like, so like being constipated would be incredibly uncomfortable. So yeah, I've been taking one stool softener every morning except the first day after surgery, because I wanted to just let things settle, and I was a little worried about it, but yeah, since then, and that's been good. I also want to thank Sky for suggesting Gas X. It's just like an anti-gas pill, like basically to stop you farting as much, or like to make it less painful, because I know that some people have a lot of pain with gas movement as well. So I've been taking that and have had minimal issues with that as well. Yeah, so I'm in no pain right now. I had one painkiller last night. Like, my pain levels are very minimal. I feel sick and very, very tired. But yeah, like, honestly, it doesn't feel like I have surgery. It just feels like I have a cold and I need to rest, basically. I can't feel that they cut me up inside. Yeah, but again, I'm young, I'm healthy, have never been pregnant, didn't have any cysts, had a small uterus, so this is like best case scenario. You know, when I got my wisdom teeth out, my dentist told me, he said, "I've been a dentist for 15 years, and these are the largest wisdom teeth I've ever seen on a female in my entire career." I'm like, oh, cool. And healing from my wisdom teeth removal, like, took much longer than I thought. Like, for 2 or 3 weeks, I was picking food out of these gaping holes in the back of my mouth with tweezers, and like having constant jaw pain. It was awful. And then for my double mastectomy, my surgeon like had a look at the left side of my left breast and kind of made a face, and I said, "What is that face for?" And he just said, "You know, this might be a little tricky to remove properly." And like, sure enough, I do still have a few lumps, and my doctor had a feel and said, like, yeah, you do still have some breast tissue like under your armpit and hair over your nipple on your left side, and that sometimes bothers me a little bit. Like, it hurts occasionally, like if it doesn't feel great. You know, so my first 2 surgeries that I ever had, just like the healing was a lot, so I was very worried about this, but you know, I think I got lucky in this situation. My surgeon had 15 years experience, and she does the vast majority of hysterectomies at that location. She had done one on a patient just before I went in, so she's very, very skilled at her job. And you know, she was confident that I wouldn't need any laparoscopic incisions, I wouldn't need any external scars or open wounds, and she did that just fine and said it went really well. So I'm glad that the third surgery I've ever had in my life seems to be like the easiest so far. Yeah, I will make another video more in depth about why I got a hysto, because I know a lot of people don't understand why you'd get one if you don't have cancer or cysts. So I'm going to explain that a little bit more. And yeah, my only other appointment I have with my surgeon, my follow-up, is at 1 month, so it's not for a while. Yeah, so I'm starting to feel really tired now. My energy is draining, so I'm gonna lay down for a bit. And yeah, see you around. Thanks for watching.